Hi everyone. Today I will be presenting my presentation on osteoporosis. Patient presentation. A 56-year-old woman comes to the hospital due to a hip fracture from walking down the stairs. Her labs show low calcium and estrogen levels due to postmenopause. She presents with stoop posture and complains of having balance issues and pain in her lower back. Etiology. As age increases, bone mass is lost faster than it is created. This disease causes the bones to become weak and brittle. In the photo to your right, it shows how porous it can become with a close-up on how it affects the inside of the bone. This makes movements such as bending, coughing, and especially a fall to cause fracture. This can increase the risk of a fracture because of the bone structure. To draw a bit of a background, osteoporosis is a skeletal disease that is known to have low bone mass, deterioration of bone tissue, and an increase in fractures due to insufficient production of healthy bone. Osteoporosis is a disease that is commonly affecting the bones of elders but is not a straight correlation of aging. Some adults who are above 60 years old can still retain strong bones. Up to 90% of peak bone mass is obtained by the age of 30. Osteoporosis-related fractures result in approximately 180,000 nursing home admissions, more than 432,000 hospital admissions, and nearly 2.5 million medical costs, escalated to $25.3 billion. When we look at the most common risk factors for osteoporosis, it's most commonly seen in women more likely than men. Those who are at greater risk are those who are older adults, an ethnicity of white or Asian descent, a family history of osteoporosis, those who have body frame sizes that are small, those who live sedentary lifestyles, and individuals who consume alcohol or tobacco use. To continue on with the most common risk factors, I added this image as it was a good way to describe osteoporosis, as it shows simple explanation of the overall disease. When we looked at the risk factors, we noted that it's commonly seen in older adults as well as most commonly seen in women. In the next slide, we will discuss about the symptoms, and one of them is dorsal kyphosis, which is a more round back. This image also points out the common fractures one can get and can be helpful when picturing a patient with osteoporosis. Common symptoms that can be seen in a patient could present as asymptomatic. However, as the disease progresses, pathologic fractures are common in the hips, spine, and wrist. This is a fracture of the bone that is not caused by the injury itself, but the disease. Dowager's hump / kyphosis is also another symptom that can occur where it is a narrowing of the back. They also can present with lower back or neck pain and loss of height over time. To the right, it shows a comparison of a healthy bone to an osteoporotic bone. This can usually occur in the vertebrae or hip, and you can see how porous it is on the osteoporosis side than the healthy bone. When looking at the pathophysiology of osteoporosis, it's important to look at the bone remodeling process. Osteoblasts, which are cells that build up the bones, and osteoclasts, which break down the bones, take form. Through different events, an immature osteoclast becomes a mature osteoclast. When we look at the osteoblasts, they produce receptor activator of nuclear factor kappa B ligand, also known as rank ligand, and this binds to rank receptors on an immature osteoclast, which then helps form a mature osteoclast. Another thing that the osteoblasts release is a glycoprotein receptor antagonist that is named osteoprotegerin, which is responsible for not producing a lot of the osteoclast. We covered that as age increases, bone mass reaches its peak by age 30. Once the body has reached this stage, osteoclasts begin working harder than the osteoblasts, which can result in more porous bones as seen in the picture to the right. Another factor that could happen is when the body does not have enough calcium. When the calcium is insufficient, the body then signals the parathyroid gland to secrete parathyroid hormone, PTH, and this can indirectly affect the work of the osteoclast by helping the body return some calcium into the blood. This can also result by lowering the density of the bone as well. Glucocorticoid-induced osteoporosis secondary is another type that could occur. The glucocorticoid affects metabolism, and this can result in bone resorption or decrease bone formation. The two process would result in osteoporosis. This is because glucocorticoids could increase the production of rank ligand, which then produces more immature osteoclasts. And that would then create more osteoclasts, meaning that it would create more of those that break down the bone. It also inhibits the OPG receptor, which helps stop the production of more mature osteoclasts from forming. Overall, the increase of rank ligand, rank receptors, and inhibition of the OPG receptor results in bone resorption or decreased bone formation, which then could result in osteoporosis. Also, women who have menopause have a higher chance of getting osteoporosis because of low estrogen. Estrogen usually regulates the osteoclast, and with not enough, it causes it to be in balance, which then produces more bones to become brittle. And this can also happen to men with low testosterone, and they can experience the same effects of decreased bone density. When diagnosing this disease, they use a dual X-ray absorptiometry, also known as DXA, and this is best for detecting and monitoring osteoporosis, but does not indicate bone quality. It sends two low-dose X-rays with the use of energy peaks and bones are examined. They use the TBS trabecular bone score to measure the mineral density. When looking at the treatments, one of their primary goals is to prevent any more fractures. The first-line medication, bisphosphonates, inhibits hydroxyapatite breakdown. This reduces bone reabsorption and strengthens the bones. They also recommend to do regular moderate weight-bearing exercises such as walking, dancing, and gardening. This process helps slow down the bone loss. Calcium is also good to intake as it maintains and regulates the bone mass and keeps the bone strong. Vitamin D is also recommended as it helps absorb and maintain calcium homeostasis. And this is my reference page. Thanks for watching.